Good morning, guys. I just wanted to say that the reason I'm doing these videos is not because you can't find this information on breast cancer somewhere else. It's all over the internet ad nauseum, really. But in my practice, I see enough where it feels like the information is not getting to people, or they're ignoring it, or they're intimidated by it, or I don't know. I mean, I just see some stuff where I'm like, how did this happen? How did this get so advanced before somebody came in? As much information is out there about breast cancer. It breaks my heart. I have a 27-year-old now that I'm dealing with bad breast cancer. Um, I have been a physician for over 30 years, but you'll never see me in a white coat or an office recording a video for you guys. I would rather come across as your big sister telling you what to look for, someone who knows a lot about breast cancer without that white coat, I'm a doctor, I know everything mentality. The truth is, we don't know as much as we need to know about breast cancer. And I'll say this, and I'm going to get off. Follow the money. They always talk about like genetic testing and all sort of stuff, but they never tell you about things that you could do to hopefully reduce your risk of breast cancer just by cleaning up the way you live. One of the biggest contributors to breast cancer that's not genetic is something called metabolic syndrome, which is the combination of obesity, central obesity, in other words, you got a big belly, high blood pressure, diabetes, elevated triglyceride, and the low good cholesterol level, in other words, the HDL level. Those things are sadly really common, especially in the Black community. Black women have a lot of that, and that increases your risk of breast cancer by eight times the normal population. But sadly, that metabolic syndrome is becoming the norm for Black women. So y'all, clean up your diet, eat organic, get out there and exercise, and more on that later. But I love you guys, and it breaks my heart when I have to tell somebody that they have a cancer that is probably going to result in them not making it, especially so young. All right, be safe, fam.